Australian Journal of Primary Health is wanting to publish good research in primary health care, but it's also about creating a repository of evidence-based practice in primary health care, and it is also a forum for the discussion and debate around primary healthcare policy matters.
There are very few journals that publish in the area of comprehensive primary health care in Australia or elsewhere. And this journal is different because it is not based around a specific profession or a specific service in primary health care. It is much more generic, and it provides a wonderful opportunity for the many people who are working in an interdisciplinary, multidisciplinary area.
The Australian Journal of Primary Health uses the WHO concept of primary health care, where primary health care is viewed as a system that is fundamental to the health of a community.
So it is not just about illness, it is about health promotion, it is about the prevention of illness, it is about maintaining good health, it is about all of the different aspects of society that are influenced by our health and that in turn our health influences. We have to look at the many economic and social and ethnic and environmental determinants of health, and this journal looks at that. All over the world, health systems are beginning to look at a people and family-centred focus.
A people-centred service is where the service is organised around the needs of the person using it, and it involves the person using the system participating in decision-making, and it also involves the service providers viewing that person as a whole being. Their needs and preferences are integral to the service that's provided. A people-centred service system takes those principles and applies them across multiple services, the practices within those services and the policies that support them. So it's focused on the needs of the person primarily, and that person, their health conditions in the context of the whole person, and the whole person in the context of the society in which they live.
The Australian Journal of Primary Health seeks to draw this together to be people-centred. Unless we know how people view things, we can't tailor a service to fit their needs. And in a people-centred system, we need to have services that fit people's needs, not people who have to fit in with service needs. And the journal tries to explore those things.
We want researchers to contribute. We want practitioners who are thoughtful about their practice and who locate their practice within the evidence base of their discipline or their service. And we also want policymakers to be submitting discussion papers on policy. By publishing those three together, we are aiming to build links between those three groups who are key to an effective primary healthcare system.
The journal has got the word Australian Journal of Primary Health. We do not want this journal to be limited to Australia. There are many issues which are relevant elsewhere from Australia. There is much in primary health care that is similar to other countries. The countries of our own Asian Pacific region are the ones that spring to mind, but similar countries in other parts of the world have many things in common. We can learn from them and they can learn from what is happening in Australia.